My name is Annie. I live in Montreal, Canada, and I was diagnosed with breast cancer at age 42 back in 2013. About 5 months after a normal mammogram, I felt a small lump in my right breast. I went back to see my doctor, who examined me and referred to my recent mammogram and told me it had come back normal, that I shouldn't worry. I also had very lumpy breasts, so he told me it was one of my normal glands. After a few months, the mass was growing, so I went back to see my doctor, who again told me not to worry, but he ended up sending me for an ultrasound. I will always remember that day. I was asked to stay for a biopsy that same day, which I did, and 2 days later, I was diagnosed with breast cancer. I only started hearing about breast density after my diagnosis. I was told that my breasts were so dense that we couldn't see anything on the mammogram, that everything was showing up as white. I remember my surgeon saying it's like looking for a polar bear in a snowstorm. They couldn't see anything. I was also told that the cancer had been growing for approximately a year and a half. My delayed diagnosis had serious consequences. I had to undergo 16 chemotherapy treatments, a bilateral mastectomy, reconstructive surgeries. There was lymph node involvement. I just wish I knew then what I know now. I wish the cancer had been caught earlier. I wish I had been told I had dense breasts and what it meant. I would have pushed for this to be investigated further. I had no idea.